Crisis is not part of the experience of every person who's lived with a behavioral health challenge, but crisis response services are an essential part of the continuum of care in our behavioral health services system. Thanks to many years of contributions of peer support specialists, the efforts of advocates, recognition by clinicians, and the findings of researchers, the integration of people with lived experience into every level of crisis response services continues to expand. The COVID pandemic has been a global traumatic event, and it's produced an increase in crisis circumstances for groups and individuals through social isolation, shut down services, layoffs, exacerbated health disparities, and tremendous anxiety, grief, and loss. COVID, like mental health or substance use challenges, doesn't discriminate, but it has hit some communities harder than others due to long-standing inequities and systemic discrimination in our healthcare and socioeconomic systems. But as our nation begins to emerge from the pandemic and address these longstanding gaps in crisis services, in their availability, in access, and in being attuned to cultural diversity, well, peers have a significant role to play. We can help expand and enhance the type and quality of services to make our system more trauma-informed and recovery-oriented. We can create more choices and pathways that help connect people with voluntary, community-centered supports. Increased funding and increased volume of people seeking help is likely to produce more job opportunities for the peer support specialist workforce. So with all that on the horizon, let's look at what crisis services look like now and where they could go in the future. Narrow definitions of crisis might focus on a dramatic event, or a risk of harm to self or others, or a critical lack of access to a basic necessity. But those who work in crisis services tell us that definitions like that can actually be limiting and may even prevent or turn people away from seeking support when they need it. Instead, we can think about crisis as being defined by the person experiencing a situation or circumstance with feelings of distress or being unsafe. That could range from a major life change, like the ending of a relationship or a job, to a traumatic loss through death, disability, or disaster, to experiencing strong emotions or disconcerting thoughts, or even everyday difficulties like having a disagreement with someone. We all know that our ability to cope with stress and change can vary from day to day, and that dealing with existing challenges like housing or income instability or health conditions can zap our energy and our ability to cope with new or unexpected shifts. The goal of crisis services is to make sure that every person is able to identify and connect with the supports and services that they want and what they need to get back into a state of wellness and recovery. When we think about crisis response services as a system, there are three major functions that it must include. One, someone to talk to, like at a community center or through warm lines, helplines, and hotlines. Two, someone to respond, including mobile teams of professionals who can travel to meet the person wherever they are, day or night. And three, somewhere to go, such as a community clinic with walk-in services, a peer respite, or a crisis stabilization program. And all of these services need to be available to anyone, anywhere, and at any time. Now, there's an important shift happening across crisis response service systems, where they're reorienting activities from a focus on risk to a focus on recovery. This quote from SAMHSA's recent best practice toolkit points out how the set and setting of service delivery in a comfortable and familiar place, and by people with lived experience of coming through a crisis themselves, can produce not just a more positive outcome for that specific situation, but they can be a moment of personal transformation and transition into a recovery journey. In any given community or county, or through a coordinated regional system, there are many different types of services that can be available. On the left, you see services that are largely voluntary and which often have immediate walk-in or call-in support and may be staffed by volunteers, peer support specialists, clinicians, and other professionals. On the right, you see services that typically involve more clinical staff than peers and may be delivered in conjunction with the public safety system. While those services are available on a voluntary basis, they're also often part of a response effort when it's initiated by someone other than the person in crisis, like a concerned family member, a friend, or someone in the community. But including peers in every type of crisis response services can make a significant and positive difference in how that service feels and functions. Peers and peer support can bring a sense of calm and collaboration into intense conversations and keep the whole team focused on creating choices, a sense of hope, and connecting that person to community resources that support their long-term recovery. Now, there are two areas where we see particularly great potential for peers to provide support at critical intercepts that can help keep someone out of the hospital or jail and instead reconnect with voluntary community-based services. One is with mobile crisis teams. When a team of behavioral health clinicians, medical staff, and peers is able to respond in a timely manner, traveling directly to meet with a person in distress, this model can be highly effective in de-escalating, resolving the immediate crisis, and connecting the person with those resources that sustain long-term recovery, totally avoiding any interaction with law enforcement, the emergency room, or the hospital. We have all seen or heard of too many situations that ended in trauma or tragedy when the response to a crisis was inappropriate, inadequate, involuntary, ended in harm, or was too late. Mobile crisis teams offer immediate expert support to a person in crisis. They save time, money, and lives. When there are not enough community-based supports, like centers or clinics with walk-in services, when they're not available to people experiencing a crisis, folks end up in the emergency room. The ER can be a chaotic environment where stigmatizing attitudes from other people seeking care or from hospital staff can lead not just to stressful or humiliating experiences, but can actually prevent appropriate screenings for other health conditions that might be causing symptoms. And with ERs too often overcrowded and understaffed, a person in crisis may have to wait for hours before being seen or may leave in frustration without getting any sort of support. But in contrast, community organizations like wellness and recovery centers, local clinics with walk-in crisis services, or peer respites can offer immediate support in a setting that's intentionally designed to be calm and comforting, where trained peer support specialists are able to spend time actively listening to what that person in crisis wants and offer supportive wellness strategies like ECPR, Wellness Recovery Action Planning, or WRAP, or intentional peer support. Now, thanks to the tireless efforts of advocates and policymakers, next summer in July 2022, a new national hotline for behavioral health crisis response is going to be launched. Instead of calling 911, which connects you to fire, police, and EMT services, anyone will be able to call 988 for assistance with a behavioral health crisis. That connects them with a specialized call center with the ability to triage calls, provide phone support, and dispatch trained mobile crisis teams. By making crisis response more accessible and providing swift connection to these alternative services, states expect the number of calls to the new hotline to increase significantly. We need a full range of community-based, culturally responsive, trauma-informed, healing-centered, and peer-driven crisis response services. The experts on what, why, and how behavioral health support needs to work in your community are the people who are using the services. So whether you're planning ahead or providing now, reach out to your local wellness and recovery center or peer advocacy organization, or contact us at On Our Own of Maryland for more assistance. Sustaining a culture of recovery throughout the full continuum of care requires nurturing hope, a sense of purpose, and community. When peer voice and choice lead service design and delivery, we create all three. So if you're listening and you're dealing with a behavioral health challenge, big or small, we need your voice. You deserve to be well, and recovery is possible. Peers are living proof. Come join us in making a system that turns illness into wellness by working together.